need to raise our fees because insurance companies will pay you what they pay up to the amount that you bill. So if they're going to pay you $110, which is unheard of, but let's just use it as an example, and you bill $100, they're only going to pay you $100. So if some insurances pay $50 and some pay $110, just to give a range of reimbursement, you've got to bill above $110 in order to get the maximum payment. So who gets caught in the middle? It's the people without health insurance who are getting the full bill for everything, which is why you should always negotiate. I mean, we negotiate our fees easily by a third, even a half. You know, I feel terrible for people who are between jobs or whatever the case may be, and they have to pay out of pocket. So I'm more than happy, and I'm glad that the hospital gives me that kind of flexibility that I can discount my fees for people. Because those aren't people that, if I'm willing to take $50 from Oxford, why shouldn't I take $50 from a person writing me a check? So I have no problem doing that. Another thing that happens certainly every year, if not several times a year, is doctors suing insurance companies because they're not paying them what they're supposed to be paying. We go through this as I just got something a week or two ago from a doctor who's suing Oxford. These are all class action suits, so they put every doctor on the suit who takes Oxford, saying that Oxford was, they list a few things. So they were supposed to pay you $50, they were paying you $49, whatever the case may be, and these become massive class action suits. So again, a huge portion of that money is going to attorney fees. And again, what a colossal waste of time and money when, you know, this is money that should be paid to physicians legitimately, and insurance companies do what they can to avoid paying, just like the other doctors said before. And again, I see this as an employee of the hospital where every once in a while we know that we're getting paid less than we're supposed to. And the insurance companies really scoff at us because they know we're not going to go after them for 50 cents on a claim until it builds up to so much money that we don't have a choice. So there are insurances that pay effectively fee for service. Every time the patient comes in, they will pay the doctor based on claims. And then there's something called capitation. Capitation means the doctor is paid X amount of dollars per month for every person who claims that you are their physician. So that's a set fee. So sometimes insurance companies really like that because their costs are fixed. And doctors sometimes like it, sometimes not. I mean, it can be beneficial for a physician because you're getting a set check every single month, regardless of whether your appointment slot is filled or not. And we've had several times at LICH where we have not gotten paid and we've had to cancel contracts with Medicaid managed care, typically Medicaid managed care companies, because they just haven't paid us. Month after month, years, you know, and there are times that say, all right, we'll pay you a third of what we owe you. Take it or leave it. Because we've already provided the service, and it means either suing them to go after them or just accepting what they're going to give us. So that's one of the things where hospitals really get squeezed. Now, working for a hospital, one of the advantages is LICH is part of Continuum, and there is a whole group of people not only who do our billing, but negotiate for us. So that's a huge advantage for me as a pediatrician and other doctors that supposedly, and I don't deny this or doubt it, that they're able to